Namaskar everyone, my name is Dr. Manish Yadav and today I welcome you all to this new lecture episode of materia medica. Especially here we are going to talk and discuss about liver remedies. Liver is a very important part of our body, and therapeutically if we think, there are a lot of cases, especially pathological cases, when we are dealing with liver becomes a very important component. And to know basically the liver remedies and to know it better in a better way so that we can use it clinically is, I think, a very important part of it. Now, there are many remedies that I'm going to discuss and share with you. Of course, these remedies, few things we know, a lot of data is already available, a lot of remedies you might have used. But basically, what I'm going to share with you is that a different way and approach of studying a drug, especially therapeutic drugs, especially organopathic drugs. Now, whenever we talk about organopathic drugs, means what is organopathic drug? Basically, those drugs which are just given on the basis of organ or specific affinity of an organ, like sphere of action or the organs which are affected. Especially these are the remedies which is given in a very low form or very mother tincture, like, especially X potencies or mother tinctures we give it. So we have, you might have also heard and maybe used kidney stone, give berberis, rheumatoid, give colchic. And that's how, liver is affected, give chelidonium or cardamom or myricerifera. So there are certain specific drugs that we use in like sabina, cesium. These are drugs which are used in mother tincture forms, and they have got some specific roles to it. But the thing is that through my experience, if I want to share with you, I think specific, if you just go with specificity of the seat of action, it does have some result. I'm not saying no, but ideally seeing, whenever you are giving a drug to a patient, the laws of homeopathy is playing a big role. So a remedy is not going to act until the law of similars is really at its best. So even the remedies that you give in a mother tincture form, in a specific drugs, there is a high chances and high value to the law of individualization. The remedies have a lot of symptoms. Even it could be very specific remedies like berberis, urtica urine, speltauri. You can use some specific drugs, right? Cholesterinum, euphorhinum, thyroidinum. Every drug has got some specific individualizing symptom. And this is what I have learned. And when I started using these things, and that's how understanding the drugs in these fashion, the results are really amazing. Otherwise, I think it is only an empirical prescription where you can give this mother tincture, it does not work, then other mother tincture, this organ, and you can say, oh, it's an organ remedy, it's a drainage remedy. I think that's an approach, is a very empirical approach. So today what we are going to discuss is that I'm going to share you, I have taken one remedy, and I'm going to show you how we can use the drug, how to know where to use the drug. Okay? How to know where to use the drug. This is very important. Burnett somewhere said very nicely that homeopath, a healer, especially a homeopath, a good homeopath, if you want to be, you have to become a good pathologist. So it is very important to know the pathology, the pathophysiology, and then you go step by step. So let us take one remedy. Let me explain you in depth this remedy. Let me show you a path how to study a drug and how to make your own notes, right? So the remedy that we are going to take up today for the study is Chelidonium. Now, Chelidonium is a remedy that is well known. Chelidonium is a remedy that is very well known. And of course, we all know that Chelidonium is a remedy which is well known for what? Well known for jaundice. And that is the reason I have colored this remedy with yellow. So what do we understand? This Chelidine is, or Chelidine is the common name, but Chelidonium is the name through which we know it. Now, yellow depicts, this PPT also depicts yellow. Chelidonium is especially given if if we just talk about a general way of giving, it is given in jaundice, where everything is yellow. The sclera, yellow, skin, yellow, urine, yellow. Also in traces of stool, some bile is there. So basically, bilirubin level rises to that level where the complete personality becomes jaundice. That's how Chelidonium is being specifically used. But my dear friends, ask yourself, there are so many remedies for jaundice. If a patient with jaundice comes, how can you just give Chelidonium to everybody? So empirically, it can sound very nice and some patients do get better, but your confidence will not be there because you don't know exactly if this is the real remedy which is working on a law of similars or not. And that's why it is a need that we go deeper into the remedies. As we learn the polycrest remedies, it is a strong need that we should go deeper into these organ remedies and learn it very nicely so that there is a very less chance of error in our prescription. First and the foremost thing, whenever you want to study any organ remedy, your pathophysiology has to be intact. Now, we don't need to become a surgeon or pathologist for that. What we just need is that we need to brush up. We have already read this, we have already studied this in our college. We just need to brush up and brush up especially first the physiology part and then the pathology part. Because once you understand the physiology part and the pathology part, you will really understand the drug, why this drug has this symptom, why and which level. A patient comes in a pathological case, every time the scenario is changing. Scenario is changing means the organs are getting damaged, organs are getting affected. Not every time the same remedy is going to be used. Every time as the case deteriorates or progresses, different stages, different organs affected, different physiological changes, pathological changes happening, you will need different remedies. And that is why, to understand how, like in pathology, we understand how the disease symptoms come in. So we also need to know that our organ remedies or specific remedies that we call, how do they function in the body, which is the exact pathophysiological condition where my drug will be needed. And that's what we have to differentiate. Like when we talk about liver remedy, there are so many liver remedies, right? How can you differentiate? Like, it becomes really difficult many times to find out the individualizing symptoms. Hence, it is very important to know the pathophysiological condition and differentiate. So Burnett, Burnett was the master in using organopathic. And specifically when we are talking about Chelidonium, he says that Rademacher was the person. Of course, Burnett was following Rademacher. Rademacher was following Paracelsus. Paracelsus was in fact the person who was the first person to give law of similars. And from there, law of simillimum came. Hahnemann also picked up. It's a long story. We can talk about it later. But Rademacher was the person who talked about doctrine of signature, who talked about organ remedies. This organ affected this remedy. And from there, Burnett took a lot of ideas. So according to Burnett, Chelidonium, what Rademacher said, Chelidonium is inner liver. He gave a term called inner liver. Now, what is it? Let me explain. Let us take a scenario. Let us take jaundice. Now, when you read jaundice, physiology, and then you read pathology, in physiology, normal functioning is what? Jaundice is nothing but, like, suppose, let's talk about bilirubin, okay? It is a destruction of RBC. Where does this destruction happens? It happens in spleen. So destruction happens. From there, the bilirubin comes in blood. From this blood, this is called unconjugated bilirubin. This unconjugated or indirect bilirubin. This unconjugated or indirect bilirubin goes into the liver. Liver has got some 3 stages of assimilation, conjugation, and excretion. So those conjugated unconjugated bilirubin or indirect bilirubin is converted into conjugated bilirubin in liver. So the process, the chemical process that goes around, and the conjugated or direct bilirubin is then thrown out through the bile duct. It comes into the blood, then transferred to the blood, then through urine, the waste products, and through some parts through stools. That's how it is being excreted. So when you see the blood report, you will always have direct bilirubin and indirect. When those direct and indirect ratio is there, it is very easy to understand where is the problem. Means where is the primary problem. Like suppose if unconjugated bilirubin is rising up, then you definitely know there is problem in the spleen. Destruction is happening a lot. RBC is being destroyed. So sickle cell anemia, thalassemia, pernicious anemia, these are the terms that you will, then the remedy and the prescription will entirely change. If it is like bilirubin, direct one is increasing, then you know there's some problem with the gallbladder or there's some problem with the obstruction, and you will try to look for the pathology which is hindering it. The remedies will change. Or there can also be problem that conjugated is also very high, indirect and direct both are very high. Means there could also be problem in the liver. So problem can be, when we talk about jaundice, it can be three places: before liver, pre-hepatic, hepatic, and post-hepatic. Chelidonium specifically is a drug when there is a problem in hepatic region. Means that the process, the liver cells are getting cirrhosed or it is getting inflamed, some damage is happening in the functions in the liver parenchyma. So the process of assimilation, conjugation, and excretion is actually not happening properly. And that's the reason why the back pressure is going up, the unconjugated bilirubin is rising, or also because there are some healthy liver cells, it is also excreting, so conjugated is also rising. And hence, Burnett said, Rademacher used to say that inner liver. He gave a term inner liver. So when the primary seat of action, it could be any disease of liver or other things, when the primary seat of liver, primary seat of action or damage or disease, the problem is in the liver, and basically it is chelidonium. I hope this makes you understand what I'm trying to talk. And this is how, in the next lecture, I'm going to talk about cardasmer, and there I will talk about where cardasmer has its big role. Once you understand their exact location and exact way they work in terms of pathophysiology, your remedy differentiation becomes easy, your diagnosis becomes very easy, and you can really help patient to a very much better level. So let's go ahead. So as I said, primary seat of action or disturbance is liver. Now, this sentence is very important. It is written in Boric. The first line in Boric, it says a prominent liver remedy covering many direct reflex symptoms. A prominent liver remedy covering many direct reflex symptoms of disease condition of that organ. Means the patient can come to you with headache, neuralgias, female disturbance, anything, abdomen problem. You might be treating the totality. You might be treating, like suppose I give you an example. Patient comes to you with migraine, and we are giving migraine totality. We are taking on totality we are giving. It is okay. Transient relief is happening, but real relief is not happening. When you look closer and you examine the organs affected, you will understand that liver is affected. She will say, I have got flatulence, I have got acidity, I have got biliousness since ages, doctor. My stools are constipated since ages, doctor. What does that indicate? It indicates that the liver is affected. And then this is the reflex symptom. So what we need to do is that there, forget the totality. You give on totality, that's okay. But you have to address the liver. You have to give something to the liver. And once that organ gets settled down, organ gets healed, the reflex symptoms will come down. So many times what we see in the patient is not the actual problem or the seat or primary seat. The primary source or the origin of problem is somewhere else. There's some organ, like there's a rubric in Boric where it says reflex symptoms of uterine region. Simasifuga, I think, is the remedy. I'd seen this case with Dr. Gajanan sir in one of his seminars. So there are remedies where uterus is affected. Uterus is the primary seat, but there is a reflex action on the some other part. Like patient might come with neuralgia, patient might come with earache, but that is not the main thing. It is a reflex symptom of the other organ. So organ has to be understood, which organ is damaged, which organ is affected. And this is one of the reasons why the totality sometimes does not work or gives partial relief. The cause. Fifth aphorism again, looking at the cause. That's what Hahnemann said. You have to find out the cause and effect, cause and effect. Many times we are just looking at the effect, symptom, which is okay. But if your remedy does not have the range of action of covering the organ also, then it is difficult many times. Hence, when you start reading Chelidonium, you will find at many places it is written associated with hepatic disturbance. Like, for example, when you look at headache, it is said vertigo associated with hepatic disturbance. Means the patient will come to you, she will say, I am having vertigo. She's on Strugeron and some remedy, and you are taking the totality, you're repetizing, you're getting some specific remedies, maybe Conayam, Pulsatilla, some other remedies you are getting. But those remedies are not giving that results. And then when you look at closer, then you find out, oh my God, liver is affected. Again, the lady will confirm about the liver functional disturbance. Maybe not the pathological changes will happen, but functional disturbance of liver, because liver is an organ which gives a lot of enzymes for digestion. So the first and the easiest way to catch the functional disturbance is to see if they are constipated, gastric troubles are there, flatulence is there, biliousness is there, vomiting is there. If those things are there, definitely the liver is affected. So vertigo associated with hepatic disturbance. In the same fashion, if you go and read other areas, okay, like when you look at stomach, it is written gastralgia, eating relieves temporary, but especially when accompanied with hepatic symptom. So patient will come and say a lot of acidity, burning, but then again there is hepatic connection with it. Abdomen, jaundice due to hepatic or gallbladder obstruction. This is what we learned before also, inner liver, right? The jaundice is because of hepatic causes, not neither prehepatic, and little bit he says about gallbladder obstruction also, but majorly it is hepatic region. Now, before I go ahead and talk to you about more about the hepatic things, you have to understand one more thing, which is very crucial, is as I began my lecture, I said that organ remedies also are individualizing remedies. You have to find out individualizing symptoms. Now, what are those individualizing symptoms? The individualizing symptoms are nothing but the most important cardinal symptoms of the drugs. How do we know which is the most cardinal and important symptoms? The bold and the italics. The bold, the italics, the underlined are the most important thing. I tell in many of my lectures, and I show to my students, whatever a patient says has to be written somewhere in the Boric, Allen, Clark, somewhere it has to be written, and especially written in bold and italics. There are so many symptoms written down, so many symptoms. People say materia medica is a maze. Yes, it is a maze. But you know what? Out of that, these are the nuggets. These are the diamonds and the pearls. What? The bolds and the italics. If not bold and italics and underline, at least the symptom has to be written in one sentence. Like earlier one we found out, right? It is written vertigo associated with hepatic. Means it is written with as a concomitant. There is a symptom and there is a concomitant organ or a symptom which is written. That is very important. Let's talk about stool. Now, liver is affected. Liver is the problem. Okay. Means what? Means there has to be some symptoms of the stool. Stool is different. There's a very good book by Kent where he talks about case taking. What a doctor needs to know about, case taking or cure. There he talks about different types of stools, the repertory of the stools. Now look at this sheet, okay? Look at this. What is bold and italic here? Forget everything. Just look at the bold and italic. Alteration of diarrhea and constipation. So patient will come and tell you that I get constipation, sometime I get constipation, sometime loose stool. Sometime constipation, sometime loose stool. Constipation, loose stool. This is a scenario for 5 years, 10 years, 15 years. He's being troubled like that. The other symptoms, constipation, the stools, very hard, round, and like sheep dung. Which remedy comes to your mind again? Magnesium muriaticum. Muriaticums are actually constipated remedy. So stool is hard, round balls like sheep dung. Another symptom which is very important is burning and itching in the anus. As the liver is affected for a long term, patient will have this discomforting sensation of itching in the anus. Ratania and sulfur is the another remedy. I'll just share you one case. I had a case, it's still going on. This patient came to me and he was having a lot of gas and acidity and all those problems and piles problem. And I gave few remedies initially, but it did not help. Then suddenly he came and he said that I get lot of pain, and he gave specific symptom of ratania. He was in tremendous pain. Ratania I gave in 30 potency repeated doses. His pain completely went off and he was so happy. After that, this patient comes and then he just complains to me that I get itching in the anus, itching in the anus, itching in the anus, burning in the anus, burning in the anus. So looking at that, because first remedy Nux vomica had helped initially. So after that, Nux, the antisoric is sulfur. You can read Allen's keynote. It is said nearly in all complaints after Nux, sulfur is indicated. So on that basis, I gave antisoric sulfur. Sulfur also did some relief for a while, but after sulfur also there was not much relief. And then other totality symptoms are not there. Now this patient comes to me and every time he talks about itching is there, burning is there, burning is there. And I was stuck in this case. And then I started thinking, what should I do? Then I looked at his past history. When I looked at his past history, then I got to know that. Then he confirmed that. He said, my doctor, my gallbladder is operated. I said, what? He said, yeah, my gallbladder 10 years before it is operated. And since then only I'm having all my gastric. So gallbladder removed. It is so easy to remove gallbladder. But what about, how can you replace gallbladder? The functions of gallbladder, digestive juices, which goes and digests, that is not there. So now what is the problem now? Gallbladder is gone, lot of load on the liver. Then I understood the seat of action is liver. Liver is affected. On that basis, when I saw this, as I said before, the symptom that you want to give, it has to be written in bold and italics, underlined, or at least in one sentence. And then I saw this burning and itching in the anus. Few more symptoms I confirmed and I put him on Chelidonium mother tincture. After Chelidonium mother tincture, I'm still continuing him. He's doing fairly well. Just an example how to use the remedies, right? How to use it. So in this case, I went into the past history and found out that the problem is in liver. Gallbladder was removed. Same when patient comes to you and says in the past history that I've got jaundice 3 to 4 times in my life. How can you neglect it? People get jaundice and then there is no effect on the organ. It is very rare. So maybe history of jaundice, history of some other infections, that has to be taken into consideration, and it can really help you select Chelidonium inverse. The word that you can find in materia medica at many places is hepatic origin, okay, hepatic insufficiency, hepatic cirrhosis, hepatic fistula. A patient, in many places it is written fistula because of hepatic problem. So patient comes with fistula, you're taking symptoms of fistula. You're thinking of nitric acid, Britannia, you're thinking of calendula, you're thinking of so many other fistula remedies, calcarea sulf, so many remedies. But first, find out the cause. Why did he got fistula? And when you examine properly again, you will find, oh my God, there's some problem with the liver. Oh, he got jaundice 3 to 4 times. Oh, his liver is enlarged. Right? Hepatic headaches, as I told you, headaches. People can come with headache, migraine, you are treating. But look at the organ which is affected. And then you find, okay, there's problem with the liver. So treat the liver, headache will automatically go. Proving, let us try to understand Chelidonium from proving symptom. Doctrine of signatures. Middle-aged physicians supposed that bitter juice, yellow juice of this plant, so nearly resembling a bile, must be beneficial in the disorder of liver. So middle-aged physicians, the juice of Chelidonium is yellow. So on that basis, on the basis of doctrine of signature, they said, yeah, yellow, jaundice also yellow, bile also yellow. So basically, this is a good remedy for liver and especially jaundice. That was their assumption. That was their understanding. But the disciplines of Rademacher have shown. Rademacher, as I told you, the person who focused on organopathic drugs. They showed his disciplines, means Rademacher and his followers and students and teachers have shown that their at least signature has proved to a true guide. They have used it by adding numerous cases of jaundice. So what they did is that with this little knowledge, they started using Chelidonium in many jaundice cases, gallstone cases, acute and chronic hepatitis cases, and those remedies, those patients got cured with this remedy. And that's how they stamped that the observation, the doctrine of signature, on the basis of which maybe sound like it was just a vague understanding, they stamped it that yes, that understanding was right. Doctrine of signature becomes a very important part in understanding materia medica and forming the materia medica symptoms. Dr. Buchman was the person who actually proved it, and later he proved it and he established the law of similars. He said it is not just the doctrine of signature or it is matching, or organ is matching, or the bile is matching. No, there's law of similars. There are symptoms to it. The action on liver is very strongly marked and is proving. So when he did the proving, the action on the liver was very much marked. That again pointed out that Chelidonium is a liver remedy. What were the symptoms? Pain. Pain was the first symptom and very constant symptom. Pain, both acute and dull. Tenderness of the organ. So there was pain which was tender, the liver was tender, and dull and acute pain was there. Whether sometime dull pain was there, sometime acute pain was there. But pain was there. So liver, Chelidonium, pain. Pain is a concomitant. Pain in right shoulder. Now, when we read Chelidonium, we find out that there's a constant pain in the right lower angle of the scapula. So right shoulder pain, there's constant pain. Stools either soft, bright yellow, whitish, costive. So again, now we know that. Diarrhea, it could be diarrhea or constipation. Appeared in nearly every prover. So every prover, these symptoms are there. So now what we understand is that Chelidonium, whenever we're thinking of Chelidonium, there has to be some kind of pain. Maybe not a severe pain, maybe a dull pain, especially in the right shoulder blade, lower part, or acute pain. It has to be there. The organ has to be enlarged and it has to be tender. The liver will be tender. So it is a painful remedy. So even in jaundice, full-blown jaundice you're giving, you have to find out the symptom. Then only you can prescribe Chelidonium. Farrington says very nicely that bryonia is very similar to Chelidonium in hepatic condition. So suppose in hepatic condition you are looking at bryonia, looking at the patient, bryonia and Chelidonium comes very close. What are the symptoms? Both remedies have these symptoms. What are the symptoms? Sharp stitching pain. Pain in the right shoulder blade. Both have it. Bryonia and Chelidonium. Bitter taste in mouth. Both have it. Yellow coated tongue. Both have it. Both have swelling of liver. So it is very difficult to differentiate bryonia and Chelidonium sometime in acute hepatic condition. But bryonia differs in stool and associated with a colic, very much like colocin. This is the differentiating point. So look, just try to understand, just try to picturize this pain of colocin. How is the pain of colocin? It is crampy pain, bending double, pressure ameliorates. So when you see liver being affected, everything like Chelidonium, but their pain is like, pain is bent, patient is bending double, severe cramping pain, colocin, like totality is coming, bryonia could be the remedy. Okay. Experiment instituted by Testis. Chelidonium with specific affinity for respiratory organ. So now till now we have read that liver is affection. But my dear friends, respiration, the lungs are also very important part in Chelidonium. Very important part. Very important part. Especially pertussis and pneumonia. So tuberculosis or pneumonia when you think about. Definitely this is the remedy to think about. So it is not just the liver. It is also can be used in pneumonia and maybe in some cases of tuberculosis also. But the question is when can be used and what is the indication? Patient comes with pneumonia, you can't just give Chelidonium. What is the indication? As I said in the beginning of my talk, there's no specific remedy. There is a remedy for site of action, but you have to individualize it. You have to find out some symptoms, especially keynote symptoms or concomitant symptoms. In whooping cough, it has been found to act especially well after corallium rubrum. So when you read corallium, it has got cough with coughing, and it throws up, continuous cough, minute gun cough. So it is said that many times corallium rubrum, where it does maybe little relief in whooping cough, Chelidonium could be the remedy. You can try it. It really seems the most valuable accession of our remedies for pneumonia. He says more than tuberculosis, it is actually for pneumonia. It is especially useful where, now listen carefully, it is especially useful where the right lung is affected and the liver is involved. Again, the concomitant. It is like pathological concomitant. So right lung is affected. Again, the side. Which side? Now this is also very important. Right side. Even with the liver also. Liver has got two lobes, right and the left lobe. The right leg, right lobe predominantly is affected. Lungs, right lung is affected. And it is said pneumonia, but liver is involved. So the primary seat of action is what? Liver. So patient will come to you with pneumonia, but when you look at, examine the liver, you'll find liver is also enlarged. And when you ask, you might get some history of liver infection, liver problem, liver symptoms, or maybe a case, past history of jaundice. And in that condition, Chelidonium becomes an important remedy. This is what I was talking about in the beginning of my lecture, that every remedy, you have to understand the pathological correlation. Then your remedy becomes very easy to understand and prescribe. Otherwise, it is just specific. Allen's keynote, it is written in single line. Pneumonia of right lung, comma, liver complications. Now this way, this is what I was talking about materia medica. So bold and italics and underline. After that, you have to find out the symptoms which are written in one sentence. And when a concomitant symptoms are given, especially pathological concomitant symptoms are given, it becomes very important. So though pneumonia of right lung, but liver complications are also there. In that case, Chelidonium will help you a lot. Let's talk about migraine and supraorbital neuralgia. Basically, Chelidonium is also a very good remedy, as we learned about liver complaints, then we learned about respiratory system. It is also a very good remedy for headaches and neuralgias. What are the symptoms? Right-sided. Again, right side. Everything is right side. Chelidonium, everything is right side. Like spigelia, left side, right? Hepatic origin. So, though headache is there, neuralgias are there, but it has to be hepatic origin. Very important symptom. Now we look at the keynote symptoms. Coldness of occiput. You will find coldness. At many places you will find coldness. We'll talk about it in the subsequent slides. Patient will say, my head gets cold, especially in the occiput region. And lacrimation. Now let's go to Boric and see what is written here. The first line, I see coldness of occiput from the nape of the neck. So patient will say, my headache is there, headache is there, headache is there. But my occiput feels extremely cold. I feel cold sensation here. Yes, you get patients. They say, I get burning in the vertex, coldness in the back. You get the patients. What is written in bold? Feels heavy as lead. So more than pain in the head, the patient will talk about heaviness. They will say it is heavy. There is a lot of load. It's very heavy. They might not said lead, but it's like if you keep something very heavy on your head, how do you feel? That is a kind of sensation that they have. And of course, we talked about vertigo, hepatic origin, right-sided headache, neuralgia. Again, another thing which is written in bold is neuralgia over right eye. Now listen to this carefully. Okay, before that, vertigo, when we talked about, this very important vertigo, falling forward. Remedies are there, falling sideways, falling right, left, back. Vertigo with hepatic disturbance and inclination to fall forward. Another very important symptom of head is neuralgia of right eye. So let's see what is written. Neuralgia over right eye. Neuralgia over right eye, right cheekbone, right ear, everything right side. But what is the concomitant? With excessive lacrimation. What else? Concomitant, preceded by pain in the liver. So the patient will come and tell you, I have got neuralgia, pain in the right side, right eye, right cheek, right ear. And you will see that the pain on the right side is with profuse lacrimation. It is not just simple lacrimation. See what is written, excessive lacrimation. So with the pain, patient is troubled with the pain, but at the same time, he is also troubled with the excessive lacrimation. And then preceded by pain in the liver. Generally, they will say, I get pain in the liver also. Before this complaint started, Before, like since 1 month, I'm having some discomfort in my liver. Again, hepatic origin. Alice keynote. Periodic orbital neuralgia, bracket right side, excessive lacrimation. See what is the adjective for lacrimation? Tears fairly gush out. It is gushing. They will keep wiping, keep wiping, keep wiping. The wiping continues, but the tears don't. No, lacrimation does not stop. That's the keynote symptom of chelidonium. Ice, again in boric, the same things are written. Okay, I will not repeat it. Now let us read some case. The best way to understand remedies is to understand through cases. Now Burnett, there's a wonderful book by Diseases of Liver by Burnett, and you can find some wonderful cases there which he has cured. Case of an enlargement of liver with jaundice cured by chelidonium. So let us see. Retrospectively, we are trying to understand. 70 years female, right-sided pain with swelled liver and tender in pressure. Skin conjunctiva, jaundiced. She was at the seaside and this, she said, upset her liver. Now we might just overlook this symptom. But listen what patient said. She said, I was at the seaside and this has upset my liver, doctor. We sometimes just ignore it. Now, this is what? This is nothing but ailments from environment, location, rain, heat, cold, sun, getting wet, drinking, hot, cold. These are the very important factors, ailments from. I'll tell you what I do when I read a remedy. Whenever I read a remedy, there are many questions I ask myself, but one of the best questions that I ask myself is why this bryonia gets bryonia symptom? Why Dulcamara gets the symptom? When you ask this, then you understand the cause. The cause, because in patients also we are trying to understand the cause. So when we are reading a remedy, then we are not asking any time to ourselves, what is the cause? How will a bryonia symptom come up? Like this only. Present predominant symptom is important, but how did it appear? You have to understand that. So when you read Dulcamara bryonia, hot climate, change in climate, drinking cold, then natrum carb, hot sun, every remedy has got some ailments from, especially environmental and food and drinks. Chelidonium has also got this. And to my surprise, when I was studying this remedy, this symptom is not marked, means it is written in boric and other places, but in repertory, if you try to find out, it is just one mark. That's why it is neglected. Now, patient says, I went to a seaside and after that, doctor, my liver got affected. Everything what patient says is very important. We might understand or we might not. How do we understand this? See boric in generals. When you look at the general in boric, it is somewhere it is written in a single line. Ailments brought on or renewed by change of weather. Ailments brought on or renewed by change of weather. Alan Skinner also writes the same thing. Ailments brought on or renewed by change of weather. I just want you to look at the symptom. Understanding the cause is the most crucial part in managing acutes or even chronics. I do it in all my cases. And whenever I'm reading remedy, I told you, I try to find out the cause. Because once I know the cause, like suppose I know pulsatilla. How does pulsatilla gastric complaint develop? Because if they have eaten a lot of cakes, pastries, fatty food, then there are food items like Clark causes, you can approach that repertory and get understanding. So change of weather, it could be anything, right? Hot to cold, cold to hot, dry weather, like somebody from north goes to Goa. From dry weather gets into a humid weather, that might affect him. There's a disposition towards him. So this is a very important symptom. Patient might come with a liver complaint, but if you go in the past, going into the past is the key. Going into the past, we don't do that. And that's why major failures come. Please go into the past. Ask where he was, when the complaint started, where he went, what he did, everything. That small detail that you get in the past can completely change your prescription and help you. And going into the past is also does not mean that only environmental factors you're looking for. You're also looking for going back and finding out the evolution of the disease. A patient comes to me with chronic complaint. Generally, we try to find out the mental state, the present predominant state. I also used to do like that, but now I have stopped. I do it later half, in the later half. First half is how did it start? Go back, go back, go back, trace the cause, trace the cause. Which was the first disease? Okay, this disease, then before that, which disease, before that, which disease. When you find out the trail from where the problem started, and when you prescribe on that basis, your results are amazing. I'm telling you, it's amazing. Tongue. Let's talk about tongue. Tongue is coated, thickly coated with red edges and showing imprint of the teeth. Mercury. You will find mercury. You will find mercury at many places. Okay. So this patient we are talking about. Retrospectively, the 70 years lady, her tongue was coated. Giddy, low spirited, pulse, intermittent insomnia, loss of appetite, and fear of death. Now, when you talk about mind symptom, organopathic drugs, they are not well-proved drugs, many of them. So, best mental symptoms have not come up. But still there are remedies, simple things. In simple lines, it is written, like in some remedies, it is written hypochondriasis. In some remedies, like in this remedy, it is written fear of death. I had a patient, I'll tell you, just 1 year before I cured that, I helped that patient a lot. So this lady came to me, and she was in a relaxation phase after her lung cancer she had, and she was off treatment, and she was just coming to me for maintenance therapy. In between, she developed eczema, not eczema actually, but I failed. Then I called the patient and I started looking into the symptoms, mind symptoms and other symptoms. And you know what I found out? The patient said, "Doctor, I get a lot of fear, especially of death." I said, "What?" I said, "Yeah." And I said, "When?" She said, "In the night, when I go to sleep, in the night, as the night comes, I feel I will die. Something will happen and I will die." And to my just curiosity, as I use only Kent and BBCR, especially I use Kent a lot to reduce my confusion. I went in Kent and this was a rubric that I found out. Mind, fear of death in night. And there are only 3 remedies: Actia spicata, Chelidonium, and phosphorus. Few more questions I asked. She had a past history of tuberculosis, family history of tuberculosis. On the basis of that, because Chelidonium also has got, we read before, thicycle. So liver complaints or tuberculosis. There is some connection with that. On that basis, I gave Chelidonium and it really helped. So this is an important symptom. Mind symptom, if you're looking for fear of death, specifically in the night. In fact, if you look at fear of death, general rubric, if I'm not mistaken, Chelidonium is not there. But when you look at the sub-rubric, Chelidonium is there. So Chelidonium are very anxious, very fearful. It might look like arsenic, midnight aggravation, he's going to die. It look like arsenic, very anxious, anxiety. They are scared they will die. But my dear friends, it could be Chelidonium also. What was the follow-up? Chelidonium ages was given and complete recovery in 10 days. She returned home, regular pulse, clear eyes, skin, all functions normal. Very decidedly opinion of that, even at 70 years of age. My God. If this patient was with me and at this age, if I would have got this result, I would have jumped in my clinic. Because I have some geriatric patients and I know how difficult it is sometimes, because they are already compromised, their immunity is low, anything can happen to them anytime. Vitality is very low. Amazing, amazing. I just loved this case. I hope you understand now, better understanding of Chelidonium. Now you will know how to pick up Chelidonium easily. Okay. Another case, enlarged liver, congestion of right lung cured by Chelidonium. Now you are knowing, right? Right-sided. A young officer in army was invalidated home from India for liver and lung disease and came to me. So he was in the army. He suffered from lung disease, maybe pneumonia he got, and liver troubles were there. So he was sent home back. I found his liver enlarged, large, tender, and right lung engorged. So now he examines. Please examine the patient. He examines and he finds out liver is enlarged, it is tender, and right lung is affected. And he says, okay, he sees that, okay, right side is affected. And what he understood, his skin was muddy, constipation was there. He was dreadfully depressed and weak. See, depressed, fear, those things were there. He was quite sure he was in consumption. The patient felt that I am in tuberculosis. And what he said, lung affection. When it says lung affection, I regarded as a consecutive or as a result to the engorgement of liver. There being, in the other words of Rademacher, primary affection of inner liver. This is what, how beautifully. I'm just amazed, many times. Just, I cannot tell you, I'm so amazed tapping into the mind of Burnett, how he used to think. It's amazing. So he says to himself that yes, lung is affected, but this lung is affected. The problem is in liver. Liver first got affected. After that, lung affected. And if you get this thing in the remedy now, in the patient, just give Chelidonium first. This is one of the very good indication of Chelidonium. To tell you frankly speaking, I have been reading Chelidonium since my college time. I never had this type of understanding of Chelidonium prescription. This is the first time, now I can tell you that I'm so confident to prescribe Chelidonium. Otherwise, I used to just every time ask, do you like hot drinks? Because that's the symptom that we have been taught. That is also a symptom. But this is how you look at the pathophysiological changes, and you can prescribe the remedy in with great success. Great success. So Chelidonium given in small dose restored him within 3 weeks. People say homeopathy is slow. I'll tell you, when the remedies act like this and you have this understanding of the organ remedies, oh my God, 3 weeks, patient got better. It is a miracle, I tell you. And this miracle can happen with everybody. We can do this. Homeopathy has got great scope. It is wonderful, therapeutic, wonderful science. Only problem is it misses an ardent student who will really study the right homeopathy. In due course, he returned to his regiment. Inner liver. Now you get it? Inner liver. Keep this thing in your mind. Whenever you're thinking of Chelidonium, problem where? Liver. Hepatic origin. Originates from liver. Liver. Hepatic. Primary seat of affection, liver, inner liver. That's why the term, very nice term, Chelidonium equals to inner liver. You can say that. Now we come to some cautions. We are at the end. Let's talk about some caution. I would, however, just dwell upon the fact that Chelidonium will very frequently cure engorgements of right lung, even when it is a concomitant of true phthisis. Means, he says, even if you treating with a tuberculosis case, full-blown tuberculosis comes and you see right lung is affected, and the liver is affected, you think of Chelidonium, you give Chelidonium, what will happen? He says, but it has no influence over the general physical state. Means, if you give, or in this condition, the liver and the right lung, that portion might improve. But Chelidonium will not be able to cure the entire tuberculous state. You might need some other remedy, because if full-blown tuberculosis is there, it might only help the organs as a seat of action. So please keep that thing in your mind. You might need other remedies too in full-blown tuberculosis. Other than what pertains to the results, the lower half of the right lung and liver will get cured. It can relieve. It will relieve. Definitely it will relieve. Target therapy, like in chemotherapy nowadays, they say, we're giving target therapy. Organopathy is nothing but target therapy. As an intercurrent remedy in hepatic complication of phthisis, it is capable of rendering very important service. So in difficult, challenging cases like tuberculosis or some other cases, you can work very nicely and you can use these remedies as an intercurrent. It will really, really help. Likewise, some other remedies he talks about as intercurrent, like hydrastis. We will talk about this in later sections. My own conception of its true seat of action is that it affects the liver cells, Rademacher's inner liver. So again, he stamps that Rademacher's inner liver. There are numerous affections of liver that Chelidonium will not touch curatively at all. Please remember this. Though we know it is inner liver, liver is so many good actions on liver, but there are numerous affections of liver where chelidonium will not touch curatively at all. And therefore, it must not be regarded as a liver cure, all liver cure, which it is not. So it is not a general remedy that any patient who comes with jaundice, any patient who comes with liver trouble, you just give chelidonium and everything will be cured. No. There's a specificity, as I told you. That's why it is important to read the drugs from Boric, from Allen's, from Clark. There will be individualizing symptom, and then only it is going to act. So it is not a cure. Homeopathy does not have one remedy for all disease. Every disease, every symptom changes, remedy will change. Same science goes to chelidonium also. For instance, he gives an example that it affects left lobe of liver much less than cardasmer. So patient comes to you with liver affection, liver problem, and right lung is not affected, right lobe is not affected, left lobe is affected. So he gives an example. Cardasmer is the remedy, not the chelidonium, though the liver itself is affected. We will do cardasmer in the next lecture. I will talk about cardasmer, very important remedy and very nice. Once you understand it, amazing, it is amazing. Cardasmer, he says, it grows transverse, means it grows towards the liver because left lobe is affected. Now, so when you palpate liver area, stomach, you'll find out transversely it grows, enlarges. And what about chelidonium liver? Perpendicular, like it goes lower. So perpendicular, it goes down. And when you palpate, you will find it. So perpendicular enlargement, chelidonium of liver, transverse enlargement of liver, cardasmer. In Allen's keynote, there's one sentence written here, very nice, and I think I should show you this. It says, old putrid spreading ulcers with history of liver disease or of tubercular diathesis. I had seen one case which Sarkar sir has shown also in some seminars at Dr. Rajesh Upadhyay's OPD in Amravati, the cancer OPD. A cancer patient, she came and she was having an ulcer. Ulcer had formed and this ulcer was spreading. It was going bigger and bigger and bigger. So sir looked at the ulcer, spreading ulcer, and in the past he found out that the patient suffered from tuberculosis. On that basis, he gave chelidonium. And the entire ulcer, it was a big ulcer, completely healed just because of chelidonium and few other remedies later on. This is the thing which I was talking about, that when you read the remedies, read the single line when concomitants are written. See, in one sentence, Allen has written everything. Ulcer, spreading ulcer, history of liver disease. So now a patient comes to you, you're treating ulcers. Generally, we are taught that look at the ulcer, look at the present predominant totality, which is okay. But please go back again, coming to the same point. How will you know the patient had liver disease? If you have not asked about the past history and the family history, you have not asked about the evolution of the diseases in the family, in the patient life itself. How are you going to know? So it is very crucial to go back into the case. Coldness. I told you that coldness is also a very important keynote symptom of chelidonium. Like we heard about, I see coldness of occiput. I'll tell you something about tips. Coldness tips of fingers. Now, it is my problem, not your problem. I know you all are smart. But when I was a student and of course, when I graduated for a long time, maybe I heard somewhere or my teachers taught it or somebody said, it was my mistake, not my teacher's mistake actually. But I had this assumption that if a patient comes and says coldness of tips, cold hands and coldness of tips, it is silica. That was my assumption. And I saw some physicians also, when they wanted to give silica, they were confirming your tips get cold. And from there, maybe I got this idea, but I was not an ardent student of materia medica at that time. So I never rechecked it. But you know what? Later, after a long time, when I really became a student of materia medica, I started looking at this. And I found in Kent, there's a rubric, Kent, coldness, extremities, fingertips. My dear friend, silica is not there, just not there. In fact, only chelidonium is 3 marks. Other all remedies are 2 marks or 1 mark. And chelidonium is just missing. So coldness of the tips, chelidonium is one of the remedy. I'm not saying only remedy. There are other remedies also. But Chelidonium, very important symptom. Coldness occiput, coldness of the tips. What about silica then? Silica has got chilliness, coldness, but it is not about tips. It is the extremities. The extremities are cold, and along with coldness, there is sweating. So when you touch the palms, there will be moisture. Patient will say, I sweat, I sweat. It is always wet. And if you get offensive food sweat, then your silica is the remedy. That's how you differentiate. So you see again, I told you bold and italics, the most important one. I see. Now in the extremities, if you look, so many symptoms are written. But why did Boric wrote icy coldness of the tips of finger in bold? Why not he wrote other symptoms like intolerable pain in the heels as bold or other symptoms? Because those are important, but the most important cardinal symptoms are those which are written in bold and italics. Get this thing in your mind. Keynote symptoms, some of them, let us revise. Few of them you know, I know, I'm just revising it. Desire for very hot drinks. Allen says, unless almost boiling the stomach. It's so hot that you can't imagine that anybody can drink it. That much hot they want. Fixed pain under the inner and lower angle of the right scapula. Always there is a pain. Tongue is coated thickly yellow with red edges showing imprint like mercury. Spasmodic cough we talked about, like small lumps flying off. Like after corallium, when you're giving corallium rubrum, it has partially relief. Maybe you can think of Chelidonium. Next, what you have to do is that please go and read Boric, please go and read Allen's, at least. Read relationships, read relationship. I want to show you something. And of course, ailments from Boric. So I will show you two or three things and then I will end the lecture. As I said, whenever I'm reading a remedy, I will never stop until unless I have seen the relationship, because that's very important. So look at relationship in Allen's keynote. It says arsenic, lyco, and sulfur. Arsenic, lyco, and sulfur follows well and will often be required to complete the cure. It is not just follows. You give Chelidonium, don't think that Chelidonium will completely cure. Maybe after that, arsenic symptom will come. Now you see arsenic, I was fear of death in night. Arsenic also has the fear. So symptoms are there. The remedies which have got very close symptoms or similar symptoms, you'll find in the practice in the materia medica that they correspond to each other or follow well very nicely. Chelidonium and lycopodium, so many liver complaint, liver remedy, desire for warmth. A lot of the symptoms again coincide, right? So lycopodium is also one of the remedies. Same sulfur, itching in the anus, itching, sulfur. So many times after Chelidonium, you might, I'm not saying that you just give these remedies. No, the symptoms of arsenic will come, or lycopodium will come, or sulfur will come. And often these are required to complete the cure. Reverse repertory is something very interesting. And just to show you how I use reverse repertory, I use reverse repertory to learn a drug. Basically, I want to learn drugs. So I use reverse repertory. So let me show you Boric. I'm going to show you something very interesting. Boric reverse repertory. There's a chapter in Boric. There's a very nice chapter in Boric called Ailments from. Look at this. Just look at this. So what are these ailments from? Biliousness, calculi, biliary, jaundice, liver congestion, pneumonia, Wills disease. What are they saying? My dear friends, out of these, maybe all, if not all, maybe few diseases you will find in the past history. So all the diseases that you find in the past history, I'm just giving you one hint. You can repertorize and then see which remedies come. So all the diseases, you might have suffered from biliousness. You might have got calculi, okay, jaundice, congestion, maybe pneumonia in the past. You know, because you need repertory, right? You want to form a totality. So you can repertorize all the diseases also, ailments from. Go to Boric, open repertory, read the ailments from, and you'll get some disease conditions named there, which can be of great help to you, especially when you are stuck and you don't know how to go back and look at the past histories and diseases, how to, mix and understand it and in a better form. So I'm done with it, my dear friends. I hope this lecture makes a lot of sense. I know it was a little long lecture, but as I know the lectures that I'm making, it is not for any fun or it is not for an entertainment. It is only for ardent students. And I know that very few students are going to watch this completely. Only an ardent student who are troubled with their patients, who want to cure, and who really feel that understanding these drugs are important will watch this video. I hope it has given you a new dimension. Idea is not to just keep watching my video. Idea is you come, you watch. My effort is to show you a way which I have learned, and then you take your own journey, take up a drug, do study like this, open your physiology, pathology, Clark, Allen's, Boric, and you develop a new understanding of the drug. How do you pick up a drug? It's only by reading again and again. It's not just reading. You can't just keep reading and memorizing a drug. You have to know the drug from heart. So that's why it is important to know it from all angles. All angles. I'm done with it. Thank you very much.